Well, for more on this, I'm joined by our political panel. In our Perth studio, we have Labor Senator Sue Lyons, and from Brisbane joining us today is Liberal MP Andrew Laming. Thanks both for your time today.
Thanks.
Thank you.
Andrew Laming, I'll start with you. Now, since 2011, there has been the Building Community Resilience Program. It's been given $1.5 million each year to help target youth at risk of radicalisation. The latest budget, the May budget handed down by Treasurer Joe Hockey, had $0 for this. Is this a smart area in which to save money?
I think it's far smarter to focus on the big picture, Tom. There's over $630 million invested in getting our major agencies, that's ASIO, ACIS, AFP, Customs, working better together, upgrading our telecommunications, intercept capabilities. These are the areas, as well as our international partnerships, that are really going to make a difference in dealing with threats like IS.
But doesn't that really come back to the old prevention is better than the cure, rather than trying to make sure radicalised people don't re-enter Australia or cause a danger? How about them not being radicalised in the first place?
Well, there's plenty of programs doing that. I mean, we have a civil society in Australia working to do that. I think we're more focused right now on the big picture, the international threat, what will be prudent, what will be responsible. And I think in Tony Abbott we have a Prime Minister up to that task.
Sue Lyons, your thoughts on the threat that IS might pose? We heard comments today, you heard a little earlier from Tony Abbott saying that this link that Jamar Islamiyah is saying that they are linked to IS is something that he's concerned about. How far should Australia go in supporting the US and whatever action they might take over in Iraq and Syria?
Well, I think we've seen instability in both Syria and Iraq now for quite some years, and that does allow for radical groups to emerge where there's poverty, where there's lack of law, where there's instability. These radical groups do emerge, and we've seen that. I do agree somewhat with the analysis of Peter Jennings. I certainly don't think Tony Abbott is up to the task to deal with this issue. We do have to see what the US is going to do. But we also do need to be doing whatever we can at all levels, and certainly providing aid which looks at and gives people different options, education, information about democracies and so on is really important. There's not one way to deal with these issues. They're complex, they're years old, and we're now seeing the radicalised element of that emerge, because really I think that the Western countries have been remiss in particularly acting in Syria.
One of the things that the Abbott government wants to do here in Australia is obviously increase or tighten anti-terrorism laws. Now, Mark Dreyfus, your spokesperson in this area, says he has concerns about, in particular, this reversal of the onus of proof for people visiting these war zones. Do you share those reservations? Should Labor be helping the government more in passing these laws?
Well, we're yet to see the full detail of this legislation, and again, certainly the reversal of onus of proof is of great concern to us, and we really do need to see the detail of the legislation. But yet again, we've seen the government really stumble over this. Senator Brandis absolutely unable to explain metadata and what was being proposed there. So let's see the legislation, but already from what we've heard, Labor's got very serious concerns about the increased penalties, about the reversal of onus of proof, and also about the whole intelligence around metadata. The government's got to be able to explain very clearly to the Australian people what it's proposing, and so far we've seen the government bumble its way through this.
OK, we'll have to take a quick break. More after the break on the GP co-payment and the latest, well, offer of compromise from the Australian Medical Association. Stay with us.
Your super.
You're watching Lunchtime Agenda. We have with us today our political panel. Andrew Laming, of course, Liberal MP up in our Brisbane studio, and over in Perth, Sue Lyons, a Labor Senator. We're going to move on to the GP co-payment. I'm going to start with you, Andrew Laming. What did you make of this proposal? The AMA is describing this as helping out vulnerable patients first and foremost. It's also notably a bit of a pay rise for doctors. You used to be a GP. What did you make of their plan today?
Well, the Health Minister will have more to say about the AMA proposal later today, but obviously the government's welcoming suggestions, sensible suggestions from the community, and that would include the AMA proposal. I mean, really a question for Labor that's dealt itself out of this debate completely is why do they having doubled the pharmaceutical copay when they were in government. Why do they allow poor Australians to pay up to $366 for pharmaceuticals, but they won't brook people paying 1 cent to see a doctor? I mean, this is a Labor government that
I'll get to Labor. I'll get to Labor in a moment.
No solution.
But your thoughts on this plan as a former GP? Your thoughts on this plan, though, first of all, from the AMA?
There is an infinite number of options available to the government, and sensible ones are welcome, looking after the poor, looking after the sick, and these will be negotiated in plenty of time between now and the middle of next year. Really, the important question is how do we maintain access, and how do we make sure that those with chronic disease can afford to see a doctor? And that's exactly what we have in our proposal with safety nets for pensioners and children.
Sue Lyons, if you go to the doctor at the moment and you get bulk billed, that service is free. Then, more often than not, you go to the pharmacy, you pay a contribution for your medicine. Now, why was the Labor happy to bring in the pharmaceutical benefit scheme and a scheme in which there was part paying for medication, but they see it as sacrosanct that anyone should ever pay any money or not have the option of free bulk billing when they go to see the doctor? What's the massive difference there?
Well, Medicare has been a feature of our health system for many, many years now, introduced by a Labor government and quite steadfastly opposed by the Liberals for many years. They've tried to knock it off before. And so what we don't want to see is increasing costs for patients, and the proposal by the government, and it's interesting now that they see themselves in trouble that they suddenly want to negotiate around this. This came out of the budget. It's nothing but a thought bubble from a former advisor of John Howard's. There's no research to say this will benefit the health system in any way, but the government put it on the table. It was set in concrete, but suddenly, because it's now getting them into trouble, they're now open to consultation. Well, they haven't consulted with health and welfare groups, and Medicare was put there by Labor as a universal free healthcare system, and that is what Labor remains committed to.
If you extrapolate that, Labor's essentially saying going to the doctor is an essential service, getting the medicine the doctor recommends is an optional extra.
And there are protections in place for people who are on lower incomes in relation to pharmaceuticals. But let's not forget what the government is proposing here. It's not just the $7 GP tax. There's also the proposal to charge for referrals. So if you need a blood test or you need any kind of x-rays, there's a proposal to charge there. I mean, where does this end? And it's all well and good for the AMA to come up with a proposal today that seeks to exempt certain groups. But the overall cost, I mean, the cost to pensioners, Mr Hockey already had that information when he put the $7 tax forward, $131 a year as an impost on pensioners, when the government's capping the pensions and doing all sorts of other things that increase costs for Australian families. The GP tax, a tax on the sick, is not on, and the government knows that now. Suddenly it's consulting over a budget item that was hell-bent on bringing in just 100 days ago. It's not on. Again, we're seeing the government in all sorts of trouble about this, bumbling around. We've now got a new batter at the plate in terms of Senator Cormann, who's now the spokesperson. Hockey's 3 strikes and he's back on the bench waiting. So they've got no idea, the Abbott government, what they're really doing with this budget and the GP tax.
Andrew Laming, when it comes to negotiation on this, the particular thing that the AMA, again an organisation you're very familiar with, was concerned about is these people they say are vulnerable to the cost of this, such as pensioners, such as families not on the highest incomes. Should that form a part of the negotiation, something that the Health Minister will be open to discussing in terms of changing?
Look, all sensible suggestions are being welcomed, and to my Labor colleague, it ends at 10 visits or $70. That's where it ends, but she's happy to have $360 as how much you pay for pharmaceuticals. I mean, my Labor colleague just then said that pensions were capped. Well, you might like to ask her exactly, Sue, how are pensions capped? And I'll give you the floor.
You've capped the cost of the pension, so over the next few years the real cost of pension is going to go down. You've also taken away state benefits where pensioners would have got concessions on driver's licences, on their rates and so on. So into the future pensioners in this country are going to really suffer at the hands of your harsh, cruel budget. You've got national pensioner organisations out today starting campaigns on you,
no cap on
and you've offered them absolutely nothing, and now you expect them to tax.
Sue Lyons and Andrew Laming, I think we're not going to quite achieve consensus today, perhaps a little bit of a taste of that stalemate over the budget, but thank you both for your time today on Lunchtime Agenda. We are right out of time, so that's where we'll end the program. Thank you both, and stay with us for Newsday coming up.